Today we're going to talk about the most ignored topic in India, that is mental health. So around 150 million people, they need mental health treatments, but only fraction of them seek it. The main barriers are maybe the stigma, lack of awareness, and limited accessibility to proper and accessible mental health treatments. So today we have Dr. Rucha Shete, who is a passionate founder of Samvad NGO. It is a mental health organization which aims to reduce this stigma and is working to provide mental health treatments and making them more accessible and affordable. So here we welcome Dr. Rucha Shete to our conversation.
Yes, thank you.
Welcome. So, can you tell us more about your journey? Like, what inspired you to start this NGO?
Yeah. So, after MBBS, I did my MD in community medicine, but there was a gap of 3 years between doing MBBS and doing post graduation. During that time, I myself suffered from a mental disorder.
Oh.
So it was like a big thing for me that being a doctor myself, I wasn't able to take care of my own mental health. So if somebody who doesn't have knowledge, how can they take care of it? So I had to do something regarding this. So after my post graduation, I worked in various organizations, mostly in tribal and rural areas, which work towards mental health. I gained experience from that. And then in 2020, during the COVID pandemic, I started my own organization.
Great.
So it just started like an Instagram page, and I gathered a few volunteers for it, and we started providing counseling services.
Wow.
Yeah.
That's nice.
So during that time, the pandemic was like a big stress for everybody in the society. We also, as doctors, didn't know what was going on and how we were going to tackle it. So as counselors, they provided a lot of psychological and emotional support too. We started with doctors, and then we went on to the other community.
Great.
And yeah, and then in November, after a few months, we registered it as a Section 8 non-profit company.
Okay.
And then it's been a lot of progress after that.
Yeah. Great.
Yeah.
So, like, what your NGO has faced any challenges to create awareness about mental health in community?
Yeah, on social media, like there is lot of pages related to mental health, but very authentic pages are very few.
Yeah, I was going to ask you that only
Yeah.
because a lot of people are into social media and I don't know how much knowledge
Yes.
is true.
Yeah, a lot of times we use mental health issues like depression or OCD or something like that very casually, very lightly. Ki I'm depressed right now just after a bad day of work or something like that. But depression is actually a disorder. Depression is actually a disease which needs medications and treatment. But so there is a lot of casualness about it which shouldn't be there on social media.
Okay.
And it needs to be tackled properly.
Okay. What has your NGO done to reduce this stigma basically in the community?
So we provide awareness through social media. Also, we take workshops. We take workshops where we like help people easily express their emotions.
Okay.
Where they are in touch with their emotions, so that accepting oneself, like who you are, what you're going through. If you can easily express yourself and easily, there should be self acceptance. कि मैं ऐसी हूँ. And then if you know that you have a problem, then you can solve it.
Right.
If you don't know there's a problem, then you will not seek help. You will not go for a treatment.
Acceptance is
acceptance.
Thing, and these workshops are online or offline?
Both online and offline. We take these workshops.
Okay.
Yeah.
Great. So just a question, like if there is a person who is in really need for mental health treatment, but he's afraid to do so.
Yeah.
So how would you advise? Like, what would be your take on this?
Yeah. So first of all, seeking help is not a sign of weakness.
True. That's something we should all accept.
Yeah,
Actually,
because nobody is self-sufficient, and if you need help, you just ask for it, and if you don't ask for it, people won't know that you need help.
Right, right.
So, and we have made it very accessible. Like, it is online. There is a website, and we provide telephonic counseling.
Okay.
So you can take counseling in your comfort space from your home. From we do WhatsApp calls, video calls, whatever you're comfortable with. So we have a website where you fill in a form, and then we put you in touch with that information. We give it to the counselor. Then the counselor sets up an appointment with the client or the person who needs therapy, and according to the schedule of both the counselor, and they set up the time and start with the session. Also, during everything is documented in our NGO. So from the entry point, and after the first session, whatever happens in the first session, we have a Google form. We document the demographics and what the person is suffering through, what kind of therapy is given to that person. Everything is documented with the consent of the client, of course. So that we maintain, we can see the progress of that client. So every call after that also is being recorded. So we've seen a lot of progress with these clients through our documentation, and it's helped a lot of people. Like
so, does your NGO provide only telephonic therapies or offline sessions?
Right now, we provide offline services also. We also do research work. Because I believe just providing services or just creating awareness is not important. Research is also important along with that. Because then with research you can actually study what kind of services you're providing, take feedback from the clients, and then if there is something which needs to be improved on, then you can do that. So research awareness along with service provision is also very necessary.
So one thing I just wanted to ask, like with these therapies, like are there any medicines also which patient requires to take?
Yeah, so whatever the counselor is the first person who assesses the client. So if she feels that it's something beyond her which she cannot help, or she's not able to provide the right kind of support to that client, or the illness is very severe, we have a counselor, psychiatrist on board, not counselor. So we refer that person to the psychiatrist. And if medications are needed, we provide medications.
Great. Yeah, so can you tell us some key projects your NGO has done and how it has impacted the society?
Yeah, as I said, we also do research work. So one very important project we did was with prison inmates in Baikala prison. We have named it Project Mukta. So under Project Mukta, we conduct interventional workshops which include a snakes and ladders game. Like we actually put the squares on the floor, and the participants have to walk on it and play the snakes and ladders game. And there are words written on it, and with the questions related to the words, which are something mental health related, like hope, gratitude, self-belief, and all of that. We play that game with the prison inmates. And we studied last year how it was, and there was a huge improvement in depression and anxiety within the prison inmates over there. Because it was like a trial prison. They were not convicted yet. So sometimes they were innocent also, but they get that prisoner wala tag once they've been inside jail. So they are not able to stand up on their own out in the society, and nobody accepts them easily. So this workshop is to make them more independent, self-reliant, and again start their life from square one.
That's really great.
Yeah.
Never thought of that angle actually.
Yeah, and we have another project, Project Rucha, which we are doing currently in 2 places. And one is in Bandra slum areas, where we train the community health workers who go into the community, and from the we have trained them to identify mental illness in the community.
Okay.
So they are lay people. They are from community. They are hardly 10 standard pass or something like that.
Okay.
But we've given them a questionnaire in their own language, and they go into the community, identify people, and bring them to our counselor.
Okay.
She goes every week to counseling clinics in that slum area.
Okay.
There are 4 clinics over there, and she then conducts therapy sessions offline in those clinics.
Wow. So, any particular project which was very challenging for you, and how did you and your NGO overcome it?
Yeah, so this project Vatavruksha only, like training
Okay.
the community health workers.
True.
It's easy to train the community health workers, but to train them to bring people to us, like convince people ki you need therapy.
And plus, these people, as you said, are like
Yeah,
they are not very.
exactly. They are very compassionate towards these people, but the thing is कि the community is not very accepting of this thing कि counselor क्या होता है, what is a counselor, वो क्या करने वाली है, हाँ, तो वो पता ही नहीं what a counselor does. So they think that she's another doctor only, but then अरे फिर medications क्यों नहीं दे रही है?
Right.
So then they don't come easily to see a counselor कि सिर्फ बात करके क्या ही होने वाला है. But these counselors are trained for different modalities of therapy like cognitive behavioral therapy, rational emotive behavioral therapy.
Okay.
So these things are not even taught at MBBS level because you're directly taught psychiatry, like abnormal psychology. Normal psychology कोई पढ़ाता ही नहीं है MBBS में भी.
Okay.
So even so psychologists are someone who know how to talk to people with mental illness, how to reduce their stress, and one major thing is कि they don't give advice to you. कि लोगों को लगता है मैं थेरेपिस्ट के पास प्रॉब्लम लेके जाऊंगी and they'll give me a solution to it. But they just help you find a solution by yourself.
Okay. So, can you share some of the success stories your NGO has done with any community or individual?
Yeah, so we've worked with a lot of medical students, and we take feedbacks from them. So we just recently got a feedback that one medical student, he was appearing for NEET exam, and there's a lot of stress with exams and studies, and obviously with other aspects of their lives. So yeah, he just messaged that he got a branch of his choice, and the therapist played a big role in getting that. And yeah, we've almost had more than around 1,000 sessions, and we've had 2,000 beneficiaries till now.
Very impressive, actually.
Yeah, in the last 4 years, we've done all these work. But one client which I want to mention, it was a very unique problem, and I was the first person to talk to that client. She had an issue. She was afraid of swallowing. Like, people have different phobias, right?
Right.
And it's kind of a mental illness.
Swallowing, like
for swallowing,
anything,
yeah.
swallowing. Okay.
So then she said that I am drinking only 150 ml of water every day because she's not able to drink that water because of that phobia. And then we started therapy for her, and slowly she came out of it and became normal. So these are the challenges we face,
because this is something actually unheard of, like phobia of swallowing. I'm hearing it for the first time.
And it affects you physically also,
of
right?
Course, yeah.
Because you're not drinking water which you need, like at least 2 to 3 liters of water every day, and she's drinking only 150 ml of water
like
because
nothing,
of
But good, you guys. She overcome it because of you guys. So.
Yeah, the main thing was she took help for it.
Right.
Because there is stigma in her family itself, because they were like कि mental illness ऐसी कोई चीज़ होती ही नहीं है. So there are a lot of times there have been clients where चुपके से they call us for therapy and all, and their parents are not agreeing to it. So they have to follow our advice एकदम, like without telling their parents and everything. But this we do only with people who are above 18 years of age, because to deal with minors below 18, we need consent from at least some guardian at least. But yeah, there are a lot of cases where various types of cases, maximum we get is anxiety, and help them strengthen their coping mechanisms and deal with their problems on their own.
Okay. Nice.
Yeah.
So next I wanted to ask, like you have like your NGO is doing a lot of projects. So how do you ensure the sustainability and long-term impact of your projects?
So sustainability is, we have a small team now. We have 6 counselors. 3 counselors are in Mumbai, 1 is in Agra, 2 are in Bangalore, like
Okay,
that.
so you work out of Mumbai also?
Yeah, so out of Mumbai, as in, yeah, we take workshops and we collaborate with other organizations, but our main counselors are there in other cities also, like
Great.
Agra and Bangalore. And yeah, we have a very team, like we have another doctor who's MD PSM like me. So she helps with the research work and statistics and data management and everything. Then we have we recently, a senior of mine, Dr. Rufi, she joined as a monitoring and evaluation. So she makes sure that whatever data is there, it is properly analyzed, and whatever impact we are doing is properly measured. So we measure impact in various terms, like what input we are doing, how is the process happening, how many clinics are happening every week and every year, like that. And then what is the outcome, like what feedback we get from people.
My next question is gonna was this only actually. How do you measure the success or progress of your
Right. So you're asking about sustainability. So we are just working on donations right now.
Okay.
Because funding is an issue. So yeah. So we are looking for funds, but right now we are managing with donations right now.
Great. So any current project you are really excited about and you want to share with us?
Yeah, so the project Vatavruksha, which I told you, which we're doing in Bandra slum areas, we really want to upscale it.
Okay.
Like, because it is helping the people in the slum areas a lot, because we are going into the community and providing therapy and creating awareness about mental health. So we are duplicating that in Palghar district currently.
Okay.
And it's a like very rural and tribal area it is. And वहाँ पे mental health का concept ही नहीं है. Like what they think mental illness is, it is psychosis.
Right.
की वेड्यासारखं वागणं, or you know, like that stigma and labeling is done over there. So only those people are taken to psychiatrists or doctors or mental hospital over there. But we are trying to train them कि उसके पहले भी like mild to moderate disorders are also there, like depression, anxiety.
Yeah, that's the start of actually everything.
Yeah, and they don't know कि उसके लिए भी जा सकते हैं, so they don't know that. So we are trying to improve that aspect in those areas.
I think rural areas में तो है ही, but I guess cities में भी people generally don't really accept it that fast. You know, we have to ask for help or something like that.
So I think वो acceptance का जो issue है ना, वो आ जाता है कि once you accept कि मुझ में कुछ है, problem हो सकता है, then you can go ask for help.
Right. So I've been waiting to ask this, like how can we as a health professionals can help to support the mental health in our clinics?
Yeah, so basically you can create awareness by telling people that it's okay to ask for help, and it's okay to not be okay also. First of all, because then people feel कि थोड़ा सा inferiority आ जाता है कि how can I be depressed, like you know. So making sure people are comfortable with that, listening to people, कि giving 2 minutes extra when you're treating somebody, like give 2 minutes extra and listen कि अच्छा why you're going, what stress are you going through, and you know, and if needed advise them to take therapy.
I think the key is listening to what
Yes.
Patient has to say. Basically, that's the As a doctor, also we have to be patient. Keep our patience.
Yes.
So next is like how can communities come together to support the mental well-being?
Yeah, so at community level, which you say, if you find somebody, like you know, being observant and coming to having like you know, not being negligent of these people, like help by reducing the stigma,
right,
like
social sympathy maybe.
तो अभी if तेरा पैर फ्रैक्चर हो गया है, it is easy for other people to accept कि oh you cannot come to the function,
Right.
but you feel कि no, I'm just not feeling okay, I don't feel like getting up from the bed, I don't feel like eating. तो पीपल क्या बकवास कर रही है, अरे फंक्शन ही तो है, इधर आएगी तो अच्छा लगेगा. बट दैट समटाइम्स गोइंग इनटू अ सोशल इवेंट लाइक दैट is also a huge stress factor for some people.
Right.
So people need to understand and accept such people ki at least let them be, like
It's okay if you don't
Yeah.
attend some function. It's okay.
Yeah.
Like be what you
Yeah.
want to be.
So trying to understand from other people's perspective, being more empathetic, like showing empathy ki like fracture you can see na ki it's easy to provide empathy to that person,
Right.
but mental illness you cannot, like बाहर से you cannot दिखता नहीं है. So then it's very difficult to provide empathy to such people, but then you have to learn
Yeah, they say like a lot of things are hidden behind a smile. So
exactly. So अभी normally even if you ask me like how are you करके,
Right.
first time we meet after a long time we ask how are you, if I actually what
we
is
normally just say I'm fine, but nobody knows you actually fine or no.
Exactly. और अभी मैं सच में बता दूँ how am I actually, तो are you ready to listen
to it.
Yeah.
Right.
Like do we have that much time to actually listen when we ask that question to other people?
True. So community level पे actually वो ही है कि you know everybody basically
Yeah.
listening is very important.
Yes.
What other person has to say.
Yeah. And you can identify early signs of mental illness.
Okay,
Like if you just ask 3 basic questions.
Mhm.
One is in the last 2 weeks how is your sleep,
Okay.
whether it is reduced, whether it is interrupted, whether you're sleeping for many hours together. If that is altered, if sleep is altered, it is a sign of mental illness. Second thing is if your appetite has increased a lot or it has completely reduced or you're not feeling like इच्छा ही नहीं हो रही है कुछ खाने की, ये हुआ है. And the third thing is your interest in daily activities.
Okay.
कि daily activities if you're not able to do properly, then if these 3 things are altered or there is something abnormal in them, you might say that this person might have mental illness.
Okay, so just 3 things: sleep, appetite, and interest.
Yes.
Yeah. Great. So I just wanted to ask one more thing. Has your NGO collaborated with any other organization or expert for any kind of projects, and how was the outcome of it?
Yeah. So we have almost collaborated with 33 organizations till
Okay.
now. Yeah. So one of them is the one I Transform, which we did the prison project with, which was they are the ones who provided vocational training to the prison inmates, and we provided emotional support.
Okay.
So we have collaborated with them on that. Another, the one which we do in Bandra slum areas is with CSSC. It's Center for Study for Social Change. So that is another big organization we've collaborated with. And now we are going to work with Dhave Trust, which is in Palghar. These are the main organizations. But apart from that, during COVID area, we did a lot of work with Rotaract Caduceus, and we did with Medicrew and other small student organizations which we did. And it has helped it has helped reach to more people. We've worked with Switch India. It's a organization started by a physiotherapist, Vinit Gada, and we've done mental health camps with them in Beed district, so that is in rural area. So that is one of our Gramin projects which we do. And so these are the organizations we have worked with.
So what do you think, like does first aid play any role in managing mental health crisis?
Yeah, first aid anybody can do basically. So that is the one who is the first responder. कि अगर कुछ दिखा, like prevention of suicide and all of that, this helps a lot.
Okay.
If you feel कि there are certain signs and you recognize these signs कि there is a chance of suicide happening over here, that is the time you provide first mental health. What do you say? Mental health first aid.
First aid, yeah. Mental health first aid.
Yeah.
Okay. So basically stopping them from doing something which is very harmful for themselves.
So taking some extreme steps. Yeah. And if you see any risk factors for psychosis, risk factors for major depression, or if you see somebody having a lot of anxiety, there are signs which you can panic attacks. Another mental illness is there, where there is a lot of palpitation, and sweating. Certain very acute panic attacks happen. That time, what you can do is like ask them to do a box breathing. Like take a paper bag and just breathe, breathe into it, or take deep breaths which help you calm down. So these are the things which you can do, or mindful walking is also one of the methods.
Mindful walking means exactly?
Like you just take a few steps, 10 steps aage, 10 steps piche, and while you're doing that, focus on how you're putting the step, like mindfully walk like that. Then your focus is on that. So, and for mild illnesses, a lot of other things which you can do, like art therapy is there, dance therapy is there, music therapy is there. There are a lot of other techniques like relaxation techniques and all of that.
So how does yoga help?
Yes, definitely. Yoga helps because mind and body is connected like that. And during exercise or any walking, or endorphins are released, which are the happy hormones. So this helps improve your mental state.
So next thing I wanted to ask is this mental health care system, do you think will be fully integrated into primary healthcare systems in future?
Yeah, I hope so it does. Right now there is it's not there. It's there in a very minimal way. But if the medical officers which work in the peripheral clinics and dispensaries, if they are trained properly to identify
to recognize this basic,
and then at least they can provide the basic psychiatric treatment over there. But right now the first problem is कि वहाँ पे doctors ही नहीं है. Like at the peripheral level, basic medical officers नहीं है, psychiatrists नहीं है. There are psychiatrists at each district. So we have our national mental health program, under which there is a district mental health program. And in the district mental health program, there is a team which has one psychiatrist, one psychiatric nurse, one psychiatric social worker. This team is supposed to be there in every district. But there are a lot of vacancies over there, and they are not filled. So the problem is पहले professionals होने चाहिए, then they can provide.
So there is a lack of professionals in this area?
Yeah, so it's very concentrated to urban areas like Mumbai.
So nobody wants to actually go and practice in rural areas.
Exactly. So I hope it
should change.
There is some dissemination and decentralization of psychiatric services. So that, because it's mostly concentrated to hospitals and clinics right now. There is they need to have more community participation, and like these doctors going into the community and talking about mental health, which is like the need of the hour right now.
So I've heard that you are a part of State Mental Health Authority. So what exactly is this?
So State Mental Health Authority is like an advisory committee in every state of India for the government with respect to mental health. So कि क्या करना चाहिए, whatever, like we have in Maharashtra 4 mental health hospitals. So the registration of different mental health institutes, inspection of these ऑडिट वगैरह करते हैं, एंड स्पेशल परमिशंस कि अगर माइनर्स को ECT, दैट इज इलेक्ट्रोकन्वल्सिव थेरेपी देना है कोई भी हॉस्पिटल में, सो दे नीड परमिशन फ्रॉम द स्टेट मेंटल हेल्थ अथॉरिटी. उसके अंडर MHRB करके रहता है, मेंटल हेल्थ रिव्यू बोर्ड, विच इज़ देयर इन एवरी डिस्ट्रिक्ट. सो वहाँ से दीज पीपल हैव टू गिव परमिशन कि अगर ऐसा कुछ स्पेशल ट्रीटमेंट किसी मेंटली इल पर्सन को देना है कोई भी हॉस्पिटल में, तो they have to take permission from this authority. So उसमें बहुत सारे members रहते हैं, and every member is like a part of, there are different stakeholders related to mental health. So there is one NGO representative, there is one private psychiatrist, there is one government psychiatrist, and there are there's a nurse who's worked in a mental health hospital. ऐसा सब मिला के they form a committee. Every 3 years this committee is formed, and at least 4 meetings happen every year, and all these decision makings and any advice or any new projects that the government wants to do, so they do through this authority like that.
What are your hopes for the future mental health advocacy?
Yeah, so I am glad that I'm part of this authority so that I have a voice. Like,
Right.
yeah, I've got a place at the table at the bureaucratic level where I can actually advise the government to take certain steps. So there is like a huge outreach through the government, right? So I can reach out to many people at the same time. And creating policy, so we've put up a proposal for creating policy only for state of Maharashtra, so that we can have like proper regulations and rules what to do with mental health just decide how to behave in a way like to protect the rights of mentally ill people.
Okay.
All of these things we can do through the policy making over here.
Okay. Wow, that's nice.
Yeah.
And the other thing is, like, if any organization or any individual wants to start any mental health initiatives,
Yeah.
so what would be your advice to them?
Yeah, so first of all, to start any to do any work related to mental health, you need to understand the nuances of mental health, like what exactly a person, mentally ill person, goes through and how to help them, because it's not like other disorders like tuberculosis or malaria or diabetes कि इसका ये specific treatment we know कि ऐसा ही है. So mentally ill person, every individual needs to be treated differently in a different way, in a very empathetic way, and there are a lot of legal aspects also to it. So if you want to, need to study all of these things, and then because how to take consent from a minor, and if other things also, like so you
lot
need
of hard
to
work, basically, a lot of research and
research,
pre-work.
pre-work needed. And मतलब if you have that much, well, you can easily start it. NGO start करने के लिए ज़्यादा कुछ लगता नहीं है. You just have to register yourself.
Okay.
You have to define what your vision, mission, objectives are, and you can register it with the government of India.
Great. So I'm really happy, like, we had such a nice conversation about Samvad NGO and what you guys
Samvad,
do. Yeah.
the word itself means conversation.
Oh, yeah.
What we are having is
Right.
Samvad. So our tagline is only beautiful conversations.
Great.
So we are trying to change the world one conversation at a time.
Also, like, if somebody wishes to donate or donate your organization, how we can do it?
Yeah, so we have our website samvadngo.com, and we have the donate button on it.
Okay.
And if anybody, they can contact us through Instagram. There is a contact us form on our website also. They can contact us if they want to donate, because to keep sustaining the organization, we need a lot of funds also.
I'm sure a lot of people will come out and reach to you
I
and
hope
will
so,
help you. Yeah. So thank you for coming us and sharing your knowledge about and giving us a lot of wisdom about mental health. Like nobody knew in depth how it is and how it should be tackled.
Yeah.
Thank you for sharing your thoughts on this.
Thank you for having me on this platform. Thank you.